Hello, welcome back this session, and we are going to continue and look at HIV infection care and treatment. What is HIV? HIV is human deficiency, human immune deficiency virus. It is called human immune deficiency virus. This is a virus which entered Uganda in 1987, and up to now, it is still taking as many people to the grave. There are many who have succumbed to it and to its opportunistic infections. Actually, HIV does not kill, but what kills a person with HIV is a syndrome of diseases which manifest in many more pictures. HIV itself is a virus, and it can lead to AIDS. It can lead to AIDS. Then AIDS is a disease which comes depending on someone's immunity and number of viruses in your body, which is called a virulent. A virulent. So a person may take as many years as 0 to 15 years to have as a latent period to show major signs of HIV/AIDS, and others may take as simple as 3 months to show great signs of HIV/AIDS acquisition or HIV/AIDS in their body. And it may take a few years to go to stages which range from 1 up to 4. So stage 1 is usually persistent genital lymphadenopathy and nothing else. So that's when you have swollen lymph nodes at some point, either in the neck or in the abdomen or in the chest, depending. So that is always persistent genital lymphadenopathies. Those are now lymph nodes. Even if you take antibiotics or you do what, they don't go away, and they are painless. They don't bring any fever, so you can stay with them for long, as long as 15 years, until when HIV will go to another stage, which is stage 2. Stage 2 is usually those are usually skin manifestations of HIV. They have a rash. You can have fungal infections which are recurrent. So now you can have let me say dandruff. But dandruff is majorly in the first stage of labor. I'm sorry, first stage of HIV, not of labor. It's in first stage of HIV. Now, when it goes to third stage of HIV, then we have mucous membrane manifestations. We can have orocandiasis. We can have TB meningitis, TB infections of all forms. We can have TB of the brain, TB of the lungs, TB of the skin. We can have TB of the bones, everywhere. So that's now third stage of labor. Third stage of HIV. I don't know why I'm thinking of labor, but third stage of HIV. And mucous membranes will always be attacked by the virus, and the virus will weaken your body, whereby fungus can attack your body seriously. Then you can have a herpes zoster in the third stage of labor. You can have herpes simplex. You can have every herpes forms. You can also have mpox disturbing you because your body doesn't have those helper T cells. Helper T cells, always HIV attacks the helper T cells. Helper T cells are the defense mechanism you have in your body, but HIV attacks them, and and those are commonly called CD4 cells. So when it attacks them, your body remains without any defense mechanism, and it means that opportunistic infections can attack you. So stage 4, we have a syndrome. A syndrome has many signs and symptoms which come in, where we have everything like we have like toxoplasmosis, we have encephalitis, we have we can also have TB meningitis, extrapulmonary TB. We can have what we call myositis. Myositis. We can have actually loss of weight, which is more than 10%. Extra cachexia. You can have esophageal candidiasis. As many things. You can have silky hair. You lose more than 10% of weight. So there are so many things. That is HIV. So it doesn't have one sign and symptom, but a health worker can assist you in staging your disease. Not yourself to stage the disease, but once you see a few things which come into that, then you try to visit a profession where they can handle HIV. Usually in Uganda, you have health center 3s and 4 and hospitals handling those cases. How does HIV enter your body? HIV enters your body through mucous membranes. For example, it enters through the biggest route is sexual route. The biggest route. It takes 90% of HIV infection routes, sexual route. And then we have others like sharing needles, sharing sharps, sharing razors. These drug dealers, they share the injections, they inject themselves with pethidine. Also another one picks it and pricks himself, not knowing that the former person had HIV and is also using the same injections. They end up mixing themselves with the infected sharps. Let me say, during accidents, if you have a wound and you share and happen to share blood during accidents, so your blood may leak up with the other one who is normal, and you get it. Then others, like kids, they get it in transplacental. HIV does not cross the placenta, but they get it during delivery, during breastfeeding. See? So when you give mixed feeding to these people, to the kids, and they're breastfeeding, you also give them food so they can easily get HIV. But these days, we encourage that because we start the mother and the father, then plus the mother and the father, we start them with the drugs, with antiretrovirals. Once we discover that they have HIV in antenatal, then if the child is born, is also given nevirapine as soon as possible, as we do the PCR. PCR is polymerase chain reactions, which are done on HIV. They usually detect HIV in as early as possible, and they are as early as possible versus the biolines we are using. So a PCR can detect HIV as early as possible than the bioline. So we are using bioline at the beginning of beginning of new life, beginning of new life of this kid, so that we can easily know that this kid is getting HIV or not. And also encourage the mother to breastfeed and do the mixed feeding so that we don't lose the kid. And it has had good impacts on many. The HIV couple, you find an HIV positive couple having HIV negative kids, and it has also improved on the desires of these women to conceive and to have kids. So HIV has been managed from 1987 up to date, and new innovations have come up, and they have been improving daily. We are having as many ARVs around, as many kinds of ARVs, from first line to third line, first, second, and third line. We have them. So we usually encourage these people who are on ART, who are on HIV drugs, to be consistent. So that is, we call it adherence as they are following. We encourage them not to share their drugs with others. We encourage them to be outgoing. They should be open to their friends, to their relatives, to the caretakers, that I have HIV and I'm taking my drugs well. So we encourage them to eat well, not to get worried, and always we ask them, if they want to produce, especially the women, to always consult us, because we can do more investigations and we advise accordingly, either this woman to have kids or not. Because maybe, for example, if you see someone, a woman who is not suppressing, who has as many who has a viremia, high viremia, may want to conceive, or a husband may demand for kids, but for us we know that this woman who has a high viremia usually has a low CD4, so may not be in a position to produce a kid who is HIV negative. So what we do, usually as health workers, as professionals, we advise these women to always conceive when they are suppressing. That means they have a low viremia due to adherence to ARVs, and they have a high CD4 at the same time. But if the reverse happens and you conceive, that means you are going to have more and more kids being born with HIV. So we have more preventive measures which have come up due to the research which has been done around Uganda by CDC, by there's what they call RACI project, and other implementing partners. They have done a lot. One, like RACI project said, that male circumcision can prevent 60% of HIV transmission. Above all, it can also prevent the transmission of HPV, human papillomavirus, from one man to a woman, or from one woman to a man. If a man is circumcised, chances of carrying the HIV reduce. Chances of carrying the human papilloma also reduce, because human papilloma also causes cancer of the cervix. So women are on the bad side always, because they go for other things, and again they end up having different things. So circumcision is one of the preventive measures. Then the other is, those are now scientific preventive measures. Then the other is what they call PrEP, pre-exposure prophylaxis. It's always given to key populations and any other person who does not know the status of a partner. Let me say I have a partner who is visiting me today. and I don't know her status, and I know we are going to coitus. So what I do is to take my PrEP as early as possible. Usually, like, you can take like a week earlier, so that by the time this person comes, your body is having only ARVs and can prevent you from acquiring the HIV. That is pre-exposure prophylaxis given by professional health workers. So what a person does is to see a counselor and a person who knows care and treatment of HIV and prophylaxis to advise accordingly. Not you to just go to the shop to just say, I want PrEP. No, it won't work. So you should pass through a series of steps to get this. And to note, PrEP is not given to HIV positive people. So that means before you get PrEP, we must test you to know that you are negative. So if you are negative, then you can give you PrEP because you have no chance of bringing your partner. So the other thing is post-exposure prophylaxis is also used to prevent HIV infection, especially where people also don't know their status. Let me see. Today I went out and I hooked a woman. If I hook a woman, I take her to my house or to a lodge where I've rented, and we do all sorts of games. So after doing those sorts of games, I realized that I don't know the status of this woman. So what I will do, in the next 72 hours, I must report to the nearby facility, whether Health Center 3 up to hospital level, which can help me give me the PrEP. But PrEP is also given to those ones who are HIV negative. So there's a procedure. It's not just like they just give you and you take. No, there's a procedure which you're going to follow, but one of them is you must be HIV negative. And most likely, if you have your partner, it is also okay to come with your partner, so that you all take your status. Because you may say you are negative when you are positive, or your partner may be found positive. You see? And if both of you are negative, then we can't give you PrEP, or we can't give you PrEP, because you are both negative. But we give you PrEP or PrEP when we don't see your partner, when we can't access your partner. But if you can access both of you, and we test all of you, if you happen to be negative, we don't give you. If one of you is positive, then the other one who is positive is taken to chronic care. Then this one who is negative is given PrEP or is given PrEP according to the policy, according to the treatment policy. So PrEP and PrEP, they are different. So they are also used differently, and they are given at different levels. So here I'm just mentioning about them so that you can know what services you can acquire from our facility and from our professional health workers and the counselor. The other modalities of HIV prevention, like using a condom consistently. So you must use a condom consistently, and that condom must be stored at the right temperature. It should not be stored at the back of your pockets on the trouser, because when you sit on it, so many things will prick it. You keep their keys, you keep their coins, so you find that the air which is always kept inside there, if you find that that air is not inside that condom, just know that that condom has a hole, so throw it off. So the condom you're supposed to use, first check the date of expiry, then check whether it has that air inside it. It has that air inside, and it's always a fluctuant package. So you feel like there's air. When you press on it, you feel like there's air. And that one which doesn't have air, of course you see it flat. It is always flat. But this one is always like a convex form. Is it a concave? I think it is a convex form. You see it bulging. It has a bit of bulge. Not so much bulging, but it has a bit of a bulge that when you touch it, you feel like it has air. It is fluctuant. So if you feel the condom doesn't have that air, then don't dare use it. So you must consistently use it whenever, wherever you are going, whenever you're going to have sex, use it to a person whom you don't know, you're not very sure. You have found yourself for the first time. Then the other thing is having one partner and being faithful to each other. If you're a couple, being faithful to each other can keep you not have HIV, because then we have more couples, you have a big network. That means you're going to have HIV. So if you find especially if you find like the key populations, for them they just go anyhow, especially people who are uniform people. This is called uniform people, the army, the police. Then we have the drivers, we have these ones, the prostitutes, the fisher folks. Those all, for them, they go anyhow. They don't mind whether to use a condom or not. So they are the most people who carry this HIV, and they can easily get also HIV. So we care about them so much so that they don't get the HIV. And the other preventive measures usually go to health workers to avoid the pricks, unnecessary pricks, to keep sharps very well. So they should, after injecting, they should not recap those needles, and they should encapsulate them. That means the encapsulation is, there is a safety box where they're supposed to throw those used needles. They shouldn't recap them, but encapsulate them, and that encapsulation box carries only 100 needles, not to the brim, but because it only carries 100 needles, and should be burnt using paraffin so that all those needles can be burnt. Plus the safety box, don't drain the safety box and bring it back to the OPD for use. No, because as you are dismantling, as you're opening the top of the safety box, you can prick yourself. So always try to put a safety box. As health workers, try to put a safety box in the injection room and near to where you're injecting from. And it should be a spacious place for safety, because I can inject and move with an open needle to take it where I'm supposed to dispose it of. If it is a small area, small working place, I may prick others. So you try to avoid pricking other people who are in the same workplace. So we should have a roomy area. Let me say an injection room must be roomy enough so that you avoid accidents in the same room because of the sharps. So also health workers are advised to use gloves, safety gloves. Those gloves without holes. There should be new gloves. Don't use gloves. Each patient with a new glove. So meaning that the health worker is protected, and also the patient is also protected, because there are situations where you find that a health worker has a wound somewhere and is injecting or is dressing a wound, also has a wound on the hand. So if you cross blood, let me say the health worker is positive, may also transfer HIV to the patient who is HIV negative. So we try also to protect ourselves, both the health workers and our patients. We protect each other. For HIV mothers who are positive, we take them to maternity, antenatal clinic if they are pregnant, and they start on antiretrovirals. That is called elimination of mother-to-child transmission of HIV, EMTCT. So these mothers, from the day of contact and the day of knowing their HIV status, they start on ARVs for their life, throughout the whole pregnancy, for their life, so that they can have an HIV negative kid. And this woman is advised to deliver from a facility where there is a profession who understands HIV deliveries, because not everyone knows how to deliver a woman with HIV. So from health center 3 to hospital level, they know what to do. And in most cases, cesarean also may be advised. A cesarean may also be advised to reduce on the contact of mother blood and the child's blood, the kid's blood who is going to be born. So when you do cesarean, there are also high chances that this kid cannot get HIV. But there are some levels where during birth that health worker may frequently do vaginal examinations, digital vaginal examinations, and they cause a lot of infections, including HIV. So we don't advise that. The other thing is, if you don't know your status, I advise each and every one of you who is sexually active to go to the nearest health facility and see a counselor. They do pre-test HIV counseling and post-test HIV counseling. Pre-test is before you do the test of HIV, and post-test is when you do the HIV test and you are given your results, not just to throw them to you. Hey, you are negative, go away. No. It takes steps. It takes a series of steps for you to get an HIV test, but in a good manner, so that you go away when everything is arrested. When your psychology is arrested, you know what to do. If you're found HIV positive, what are you going to do? If you're found negative, what are you going to do? All that advice is always there. Counseling is the way to go, and not just testing and go away, because if people have gone away and they have found themselves with enough stress, anxiety, stress, depression, and the other way is committing suicide, because they are carrying a heavy load of thoughts which they can't solve. They say, now, I'm having HIV, it means I'm dead. So why should I die now? So counseling prolongs someone's life, that whoever thinks of dying today and may not die today, because HIV is not something which is going to kill you, but what will kill you, the opportunistic infections due to your reduced immunity. And usually, we advise people to visit a counselor whenever they have challenges psychologically. Even on ARVs, if they're on chronic ART, they can also have chronic treatment. They can also have challenges. So they can always visit the counselor. And most of these centers up to hospital, they have counselors, professional counselors who can handle them very well, and they can prolong their life. Actually, a person on ART and is adhering very well to ART can survive 20 to 30 years. And within those 20 to 30 years, you can do so many things. If your kid is about 2 years, can you imagine that you're going to die when your kid is about 22 years? Maybe. So that's one of the reasons. So I encourage everyone to visit a nearby health facility and get HIV testing, get counseled, and get ARVs in the right steps, and the rest. Because you may not go only for HIV testing or HIV counseling, but even plus other HIV other counseling procedures are there. So you can go and they can see further things. So until we meet next time, thank you.